board experience, it was a lot of work. There was 6 months worth of activity between the board of directors and the staff. It was an exceptional process, one that I felt was very reflective of what the issues New Hampshire were facing, particularly around the demographic changes that New Hampshire will be foreseeing in the future. The board engaged in this process. Everyone participated. Robust board discussion, staff discussion. We had content experts from across the state join us. We had reviewed some demographic research. That all helps put the course forward for us over the next 5 years.
Our overall objective was to devise a plan that will allow us to allocate the endowment's resources in the most effective and efficient manner to improve the health of New Hampshire people, with a special emphasis on the vulnerable and underserved. And I believe this plan does that, and we're very excited about it. Two population groups that really jumped out are seniors. We have one of the oldest populations in the nation, and we're aging faster than most other states. The other group are children. We don't have many children. We have one of the lowest birth rates in the country. We also know that more and more of our children are born into poverty or live in poverty, and recent statistics bear that out. So there are some real challenges going forward. We should be concerned about this just from a human perspective, but also from an economic perspective. This is about making sure we have a healthy, innovative workforce. In addition to the new priority areas, we're going to continue to focus on children's behavioral health and health equity. And of course, we're going to be continuing the work we've done in the economic barriers area. We're going to be doing that under our new health policy capacity building initiative. We heard from hundreds of community partners, and by and large we heard that they felt our most important role was what can be characterized as field building. That's really shining a light on important problems or issues, bringing people together, convening people to solve those problems and work on those issues, and then supporting the collective action of that process. There's this old African proverb that if you want to go fast, go alone. If you want to go far, go with others. It's very clear to us that the endowment cannot act alone. We'll work in partnership with other organizations around the state, other individuals, other funders, government. We recognize that this is only going to work as a partnership.
The plan is an amazing plan. I think it really is a roadmap for the Endowment for Health, for the staff, for the board, and also for our community, greater New Hampshire community. That roadmap is identifying key issues that the Endowment for Health will be working on over the course of the next 5 years. The staff and the board are very excited about this plan and are proud to present it to New Hampshire.
Our vision is very simply good health and realized potential for all. New Hampshire's prosperity depends on healthy people, strong families, and vibrant communities. We envision a culture that supports the physical, mental, and social well-being of all people through every stage of life.